think, Andrew, yeah? Morag's not in yet, is she? No.
Yeah, I'll make that 2 o'clock, convener.
Yeah, okay. Shall we just get started then? Well, welcome to the Adult Health and Social Care Committee in November. It's morning, I'm here in my room, I'm doing a bit of civic, I'm sorry. Has anybody volunteered to go to the civic? For the hybrid thing, no?
Convener, that's not applicable for this meeting. We're still not in a position to do that yet until next year.
I know, that's why I'm nice and warm. It's really good, isn't it? We can all sit here and gloat. Have we got any apologies, substitutions, Andrew?
Yes, convener. So I have one substitution. Councillor McManus is substitution for Councillor Damasio, and then apologies from Councillors Catherine Johnson, Tommy Morgan, and Caroline Stephen.
Okay, doke. Right. Do we have any declarations of interest before we get started?
Chair, can I come in? Councillor McPake here. I'd like to declare an interest in item 10, albeit remote, but in there it talks about taxi services within North Lanarkshire, and the company I pay my radio is mentioned within the report. So to avoid any doubt, I will take no part in that and I'll be excluded from that item. Thank you.
Thanks very much, Michael.
Convener, sorry, apologies. Councillor McPake, did you say item 10? I've only got 8 items on my agenda.
Oh, let's over the page. I've got to number 13.
Yeah,
oh.
Item 10,
oh.
yeah.
Oh, I must have a dodgy copy. I'll get another copy. My apologies.
Okay. Yeah, it's a taxi one. No more declarations of interest. Shall we proceed to item 2, which is the update on COVID-19 activity. Ross, over to yourself.
Thanks, convener. So just to give a quick update, this is a paper that is probably out of date the moment it goes out in the packs, unfortunately. So I'll try best to bring an up-to-date position as of today to members. So the current, just working through some of the figures, the current position in the acute sector in Lanarkshire as of this morning is 111 COVID positive inpatients. We had no deaths over the last 24 hours. We've currently got 6 in level 3 ITU. There are 2 COVID positive inpatients in our off-site facilities. Across the entirety of Lanarkshire, we have got 6 care homes that have got ongoing outbreaks. Cumulatively, that is affecting 11 residents and 14 staff. So the numbers in terms of those affected are still really quite low in care homes, and we've obviously been going through the booster programme in the care homes as well, which will have a significant impact. Yesterday, across the entirety of Lanarkshire, we had 338 cases of COVID diagnosed, and in terms of our vaccination programme, we've now administered 1,178,549 doses, and we're through 160,000 boosters and just shy of 170,000 seasonal flu vaccines as well. So quite significant progress in terms of the overall booster programme. In terms of care homes, as I noted, we've got currently 6 outbreaks, but a lot of work ongoing in terms of supporting the whole broader care home sector. We've still got a fortnightly care at home assurance group that is running, and that's a pan-Lanarkshire group, including nurse directors, chief social work officers, operational heads, etc., and provides a whole range of different support and also assurance visits around the care home sector. It should be noted we've got ongoing work in one of our care homes in North Lanarkshire in terms of Hill End View, and we're continuing to work alongside the care inspectorate with that in support of that care home, following the care inspector identifying a number of improvement actions that are required to be completed. In terms of PPE, we've got no ongoing issues, very different to the start of the pandemic, where PPE was one of our greatest concerns, but that's now really well resolved. And just, I suppose, business as usual now. In terms of delayed discharge, this is an area where we've made really significant progress over the course of the pandemic. In March 2019, we were sitting with 125 delays. over the peak in August and September. That was moving back up towards 100 again, but as of today, we're sitting with only 54 delays with a further 16 discharges on the books for today. So we're making really good progress around our delayed discharge performance, and we're now benchmarking in the bottom half for Scotland in terms of rates of delayed discharge, whereas pre-pandemic we were at the other end of the table. So that's great progress following a really significant amount of work around the rollout of planned date of discharge and ongoing daily scrutiny that Diane chairs the PDD meeting on a daily basis, and that runs through every single delayed discharge on the list and every planned discharge on the list to make sure that there are actions in place and we're working those through to completion. In terms of testing, we've got ongoing staff testing using lateral flow devices and also PCR testing where required in our long stay and COVID wards as well. And beyond that, I think we've provided an update in terms of COVID vaccine. Again, the staff programme is well underway in terms of providing staff boosters as well. And I think just for committee to note, as of yesterday, the portal for COVID boosters for 50 plus opened, but it also actually extended who was eligible in there, and I don't think it was particularly well communicated at the time. So we can now, non-frontline health and social care staff, including social workers, are now eligible, as well as teaching staff, pupil support staff, etc. as well, are now able to book their booster as long as they're 6 months post second dose, and then they can book in a booster appointment as well. And that is now also rolling out to over 40s as announced yesterday as well. So quite significant progress around the booster campaign, and really a lot of pressure now to try best to ramp up and get as many done before Christmas as we possibly can. But happy to take any questions on the content of the report.
Bob Burgess, have you got a question?
There's somebody before me there, convener, but I'll come in now.
Okay,
Yeah, Ross. Yeah, could I ask, do we know how many of our National Health Service staff are they remain unvaccinated at all? Is there any that we're aware of?
I don't have an exact figure for you, but I mean, I think it was high 90s in percentage terms in terms of uptake. So I couldn't give you an exact figure off the top of my head, but I mean, I know that we were up, not far short of 100% in terms of first and second dose. And there's a wee bit of challenge now in terms of how we monitor it. So the first and second doses were all managed in-house through occupational health. So it was very easy for us to track the numbers, and we were able to do the same for social care staff, etc. And we could work it down into staff groups. Nationally, now you can book through the national portal. So you can go to wherever you live and just go to a normal, and book into your own local centres, which means it's much more difficult for us to track the uptake of the booster campaign within our staff. So unless staff self-reported in to tell us, it's much more difficult for us to trace the booster population or uptake. Sorry. So I mean, it's very, very high uptake, and certainly I know in NHS England have taken the decision to make it compulsory. As far as I'm aware, in Scotland, that isn't a move that they're looking to take just now, off the back of the fact that the vaccine uptake has been so high. Yeah,
that's fine, Ross. I'm happy with that. But I've also got to bring in the visitors and staff to the care homes. Have we got any idea where the infections are coming from? Is it staff or is it care home visitors?
I mean, to be fair, it's very, very difficult for us to trace exactly where it's coming in. I mean, the care home staff work and live in the local population largely. So when we see big spikes of COVID in the community, it's largely inevitable that it's going to make its way into care homes, because the staff themselves, any contractors, any supplies going in and out the care homes, relatives and families going in and out the care homes, they're all from the local population. What you can see is a marked reduction in terms of the scale of outbreaks. So early in the pandemic, pre-vaccination, when we were getting COVID infections into a care home, it was affecting a really massive number of residents and staff at the same time. But you can see that we've got across 6 care homes, it's 11 residents and 14 staff are all that are affected. So it's a massive improvement in terms of where we're at before. And again, we know from the early data on the boosters that will have a really marked improvement as well in terms of protection. So hopefully we'll see those numbers coming down even further.
That's fine, Ross. Thanks. Keep up the good work.
Thanks, Bob. Claire.
Okay, thanks, Kavina. Thanks, Ross. It's a positive report. Can I just see the delays for people getting home? Is there a particular reason for that, or is it like kind of varied along the line? Is there a delay in occupational therapy being able to get out? Is there a delay in getting different mobility aids into the homes to allow people to discharge? Is there a kind of common denominator, or is it varied depending on the people?
There's a big range of issues here. I mean, I think the reality is that it's nigh on impossible to get down to 0 delays. If you have a look at a delayed discharge is beyond midnight on the day of clinical readiness. So the date that the consultant says you're clinically ready to leave, the next day you're at a delayed discharge. So the aim of planned date of discharge is to try best to bring that planning piece forward. So in Lanarkshire, how we tended to work beforehand was you'd get marked as clinically ready, a referral would be sent to social work, and you're automatically a delay as soon as that referral sent to social work. Whereas now what we're trying the best to do is identify these individuals earlier in the journey, so we can start the planning before they're ready to, before they're clinically ready, and then have the package set up and lined up for them going out. So in terms of reasons, there's a whole range. There's home support capacity, which is particularly constrained, and just huge increases in demand coming through the system make that ever more difficult. So we've also got real challenges in terms of equipment as well. So we've got significant shortages of equipment. So things like steadies, commodes. We can't buy any new commodes in Scotland, and haven't been able to for the last 3 or 4 weeks. So we're running really short in terms of supplies of commodes, etc., etc. So there's a whole range of issues there that are coming through. And another one that particularly challenging is around adults with incapacity. So we look at the national standard for adults with incapacity as it would take about 13 weeks to complete the process. So that's 91 bed days, and we're unable to make any moves for those individuals during that process. Now that's saying that that's absolutely optimal is 13 weeks. You can imagine trying best to get court appointments, etc., during the pandemic makes that even more difficult. So 100+ bed day delays are not uncommon around adults with incapacity. And we're working with Scottish Government colleagues around and also Mental Welfare Commission around this, because it doesn't feel right that quite often these individuals will be in the last year or two of life, and the thought of spending 100 bed days in an acute ward just doesn't seem correct, does it?
Do you be supplementary, Tom? Do you mind?
You're on, you go.
So I think for the number 54 delays is a really good. I mean, it's a good figure. But can you give me an idea of how many would you say then is at the top range, at kind of the longest delay? Have you got the kind of an idea, just roughly? Is most of them kind of just a matter of like a few days, or is there a lot at the top range?
No, I mean, I think we normally average around 10 AWIs at any one time. So I don't even think we're at as high as that. I think we're at 7 or 8 just now in terms of AWI delays. And then the rest will be much shorter in length. And, I think the probably there's the vast majority will be sitting in single figure delays, and maybe get up to 15, 20 when it's complex assessments. And we've got particular challenges as well around some care home admissions. So some of those delays will be around care home, and either waiting for care home of choice, and also off the back of the pandemic, care homes are obviously very, very concerned about the number of admissions they take at any one time. They need to support a 14-day isolation coming in to try best to protect other residents, and care homes are constrained in terms of the number of individuals they can support in that way at any one time. So You know, care home admissions, etc., are also an area where it's causing extra challenge.
Thanks very much for that. I don't think for a second that my questions are belittling the fact that I think and especially at this time, to have a figure like 54 delays is really, really good and well done. And thanks for all the work that's been done, Ross.
I think we can all agree that, Claire. Yes, it's fantastic figures, those reports. I don't see anyone else in the chat, so we're being asked to recognise the progress made and support the work commenced. Can we all agree to that? Yeah. Take that as so. That moves us on to number 3, which is the carer support update, and Morag, I believe, is going to give us an update.
Yeah, thank you, Chair. I hope everybody can hear me okay. I had a wee bit of technical issues getting in there, so I hope you can all hear me okay. The report this afternoon is really providing information about the range of work that's been undertaken to support and further support carers in North Lanarkshire, recognising clearly, as we do, that the enormous role that carers play in supporting loved ones on an unpaid basis in North Lanarkshire. And whilst there's a duty to provide support through the Carer Scotland Act, both to provide support to adult carers and young carers, and really focus on the needs of carers and their individual outcomes separate from the people that they support. That duty also extends to providing good information and advice, planning forward into the future, providing advocacy where it's needed, and to ensure that practical supports are in place. But although it's a duty on us, we would clearly recognise the importance of working in partnership with carers and doing that because it's important to strengthening our whole system approach to the support that people need. To recognise that a lot of the ambitions in the strategic commissioning plan actually reflect the importance of the role of carers in it being a good place to work and volunteer and care, but doing the right thing the first time, living well in connected communities, and focusing on what matters, all reinforce the importance of us working effectively with carers. And again, all the more important because of the impact of COVID, where we know that the numbers of people who have who do undertake a caring role, but increasingly who recognise themselves as carers, has increased through the period of the pandemic. And we also know from our own field and from wider research that the complexity of the support arrangements carers are involved in has also increased. So increased amount of time caring, and the people that are being cared for have increased needs. So the report goes on to describe the role of the commission services. So we've got 3 main commission services, North Lanarkshire Carers Together, which you'll see from the report provides an enormous range of supports and opportunities for carers' voice to be well represented, and for people individually to be supported through good information, workshops, training, and also the introduction of the advocacy service through that commission route as well. Lanarkshire Carers Together, who are probably more focused on undertaking the adult carer support plan, have played again a really crucial role all through the pandemic, particularly around the delivery of personal protective equipment when that was more difficult to get, particularly for carers. But supporting the Short Breaks Bureau, where North Lanarkshire matched Scottish Government funding and increased the financial resources available to do that, but also working in partnership with the 3 acute hospital sites to make sure that the experience of admission and discharge from hospital for carers is well supported. And I think an issue for all of us is the development of digital technologies and ensuring that carers are equipped and skilled in terms of accessing and being able to make use of the widest range of opportunities through digital developments. And Action for Children, providing a wide range of services on an individual and group basis for young carers, obviously a particularly important area to focus on, and you'll see from the report again a very wide range of responses through training, for example, blues and identifying early signs of depression, to Facebook links and lots of activity supports that they are involved in. New developments to note, the carers breather, building on the success of the Community Solutions Programme, and really encouraging the widest interpretation of caring, and often people come with multiple labels. They wouldn't initially see themselves as a carer, and very much trying to target unknown carers, particularly unknown carers to services. That the carer breather work is really important to try and expand the range of responses and opportunities that we have. The hospital support programme, particularly planned date discharge to assess, and ensuring that we've got a robustness around the support arrangements there. Short breaks, where the opportunity for people to have a break from the routine rather than necessarily from each other, increasingly is something that we're learning is important to carers. And initially through the pandemic, we anticipated about 160 people accessing short breaks, but in fact 458 did, and we're continuing that into this year. And SDS, self-directed support transformation, where the kind of double prong of ensuring that supports are well designed around individuals, which in itself helps carers, but also ensuring that carers access directly to individual budgets is something that we're particularly paying attention to and expanding, is detailed in the report. Additional work around carers' pathways, and the role of advocacy there. PAMIS, which is an organisation that particularly supports individuals and families with profound and multiple complexities, and helps us to engage effectively with that range of organisations and individuals, and increasingly ensuring that our understanding of carers and the profile of each locality through the carer census work is maturing as we continue to do that. So we're very much trying to adopt an approach within support to carers which links the work around communities and people with lived experience and advocacy services with the supports for carers, to do that kind of really robust whole system approach to the needs and supports that are required on an individual and collective basis. And the report details how 4 million of the carers' monies are used, and the resources around the carers' breather, short breaks and hospital support is included in the report as well. I know that I've gone through that quite quickly, but the report is very detailed, and we've worked closely with our independent sector providers to compile information and use that locally. So hopefully people have found that of use, and happy to take any questions.
Thanks very much, Maura. I don't see anyone in the chat. We're being asked to note the contents of the report. Can we all agree that? Yep. Thank you very much. And number 4 is the equipment and adaptation services, and Diane's going to speak to this paper.
Thank you. Yeah, this report outlines the current position of the equipment and adaptation service. It covers a number of areas, including service demand, the impact of COVID, performance, and the actions to refresh governance arrangements. The integrated equipment store provides essential services to individuals and staff, and this includes provision of equipment, adaptations, essential maintenance, which includes dealing with contractors for adaptations such as stair lifts. Section 2.1 of the report sets out the factors that have contributed to the demand which the service is seeing, and this includes changes in population, increased complexity of health needs, and increase in people living at home. The service has also been responding to a high level of referrals to facilitate hospital discharges, which Ross described, and this includes the delivery of equipment to ensure important safe discharges. The report highlights the need for demand profiling and modelling, which will be undertaken to understand the demand in more detail to inform service redesign. Performance is also outlined in section 2.11 to 2.16, highlighting that there are improvement actions required to ensure equipment is delivered within 7 days. However, urgent requests to facilitate discharge and prevent admissions are being prioritised, with over 95% of requests being delivered in 4 days. The impact of COVID-19 has created additional range of demands on the service, and with restrictions impacting on service delivery. And this includes services such as recycling and uplift of equipment. As Ross described, the disruption in supply chains has emphasised the need to recycle more than ever. So we are seeing pressures in beds, hoists and steadies, as Ross described. The store also had to make significant changes to ensure delivery of PPE and testing kits to staff across the Health and Social Care Partnership, and this will continue throughout the winter. The report goes on to update the current development to introduce new governance structure and service design developments in response to the changes in the service that we've described. And we will be able to return to committee with a further report in the future. If there are any questions, happy to take them.
Thanks very much, Diane. I don't see anyone in the chat, so the recommendations are to note the contents, to recognise the changing service delivery needs, to endorse the refreshed governance arrangements, and to endorse the service review and anticipated future reports. Can we agree that? Is anyone otherwise minded?
Councillor Fisher, Councillor Burgess has got his hand up.
Oh, I can't see that. Where is it? Oh, well. Bob?
Yeah, thanks, Tom. I didn't want to come in over here. I couldn't get the chat going there.
Could you know I was right? I'm just looking at the chat, Balia.
Yeah, I couldn't get into it. I don't know what's happened there. But Maura, can I ask you about ramps? I seem to be having a problem with ramps. I've got 3 people at the moment who are just going nowhere with ramps. Have we got a problem on that situation? And it's basically down to an obesity situation, bedbound, and a ramp is actually needed to get her into the hospital. So can you tell me, have we got a problem with ramps?
I'm not specifically aware of a problem with ramps, but I'm happy to take that offline with you, Councillor Burgess, and follow them up.
Sorry, I'm saying that to Morag there, Diana. I didn't mean that was you. Yeah,
that's okay.
Yeah. If I could contact you on it, could I please?
Yeah, of course. I'm happy to pursue that. No problem.
Okay, lovely. Thank you.
Cheers, Bob. Anyone else? No? Can we agree the 4 recommendations on page 25? Yep. That's good. That leads us on to number 5, the prevention, early intervention, community capacity building and well-being. And Ross is going to speak to this paper. Thank you, Ross.
Okay, thanks, convener. This is a bit of a catch-all report, and it pulls together a whole range of the work we're doing around prevention, early intervention, and just such an important area for us to try our best to get ahead of the game a little bit, and try our best to be as proactive and anticipatory as we possibly can to support people, to support themselves, and take control of their own situations and lives, and also obviously really a key part here as well in terms of trying the best to control some of our future service demand. Just in terms of summary around the prevention and early intervention work, I mean, I think that the key bit I'd like to pull out here is just the importance of whole system working. So all of this work is trying best to come across from the Community Planning Partnership through the Plan for North Lanarkshire, across NHS Lanarkshire partners, and broader. And just a few examples, we'll get things like the Green Health Partnership Bike Amnesty. So this has been supporting the recycling of bikes through restorative justice, and then going out through the independent sector through GBT shots. We've got things like the diabetes and weight management groups that we're rolling out across North Lanarkshire leisure facilities. We've also got pieces like the Healthy Schools programme, running between health improvement colleagues and education and families. And we've also got the high resource users projects. This is a programme where we're identifying individuals who are frequent attenders to accident and emergency departments and trying to best identify how we can provide extra support elsewhere, so that they don't require that level of treatment continually. So we've identified an additional 30 individuals in Coatbridge. And we're as part of that programme, so we can try our best to have a look at whole system ways of resolving some of the challenges that those individuals are facing. And also through the community boards work, we've been developing the LOIPs for each community board, and health improvement teams have been really central to that process as well. So really trying our best to build in that health improvement focus from the community boards right up. So that's a sort of whistle-stop tour, but I think really important to note that the progress has been made on a whole system basis around that. In terms of the mental health and wellbeing strategy, members will remember this coming through Policy and Strategy Committee pre-pandemic, and identifying the sort of 4 main work streams around this, around good mental health for all, which is looking at really early intervention and supporting good mental health across all age groups and the whole population. Improving access to supports and services. We've got a work stream around children and young people's mental health and wellbeing, which is really important, covering things like CAMHS, but also through some of the school counselling services, and really importantly through Tier 1 and Tier 2 sort of lower level interventions across the community and schools. And then the final one being around specialist mental health services, including perinatal and infant mental health. So the delivery groups are all back up and running as part of the mental health strategy implementation. We're currently doing or just finalising the work around redoing the entire delivery plan. So the delivery plan is obviously not quite on schedule because of COVID, but what we're doing is working across each of those work streams and every individual piece of work identified in the strategy and re-baselining that delivery plan. And we'll bring that back through committee through the next couple of cycles once that's absolutely completed, so you can get sight of the exact delivery plan that we're working, timescales that we're working towards. We've got significant investment coming in through mental health for both CAMHS and psychological therapies particularly, but a range of other areas as well. But for both of those, we're trying our best to re-baseline the capacity of the services. We've got about £4 million recurring funding coming in. And I suppose the challenge being actually just getting the bodies in place now. Unfortunately, recruitment is proving very, very challenging. But the fact that we've got that recurring funding now will allow us to gradually move and increase the capacity of both those services. And particularly CAMHS has really struggled through the pandemic with a significant increase in terms of urgent referrals, which we've had to prioritise. So all urgent referrals are seen within sort of 24, 48 hours. But it means that sort of more run-of-the-mill cases are then having to wait that bit longer because we're taking up so much capacity with the urgent cases. So we're just working out and rolling out now the CAPA model, and the CAPA model aims to get a really senior decision maker to triage all referrals as they come in. And the aim being through that early discussion with the young people and families, we can much better identify the needs and requirements. So if that means that it's not actually a CAMHS case and could be supported through a lower tier intervention, we can make an immediate referral and get that support in place at that very early stage, rather than as it currently would be waiting 18 weeks before we have that conversation. And also means that we can then make sure that if they are going through service, we can get them through the right service supports much more quickly. So Grampian Health Board have rolled out that model and it's worked incredibly well. So we've been doing a lot of peer-to-peer work with Grampian just around the implementation of the CAPA model going forwards. And then jumping on to the last section of the report around community solutions. A huge amount of work has been done through the community capacity building work alongside Van El. And members will remember back a year or two ago where we did a service evaluation through the improvement service around Van El. And they identified, real great strengths in terms of community solutions programme, but also a few improvement actions that we could take forward, which we have been, I think, are largely now all complete. The programme has been really well recognised nationally. It was part of the NHS national conference earlier in the year, and also through the work we've done through community solutions. Scottish Government are now identifying some areas of direct award out to third sector interfaces for the first time. So we've got about £1 million of additional funding coming into North Lanarkshire, direct to Van El, to provide some low-level mental health and wellbeing supports in the community. They're also, Van El, working alongside education and families around some of the children and young people's mental health supports as well for early intervention. So we can see some real expansion and some great investment coming the way of the Community Solutions Programme. And the IGB earlier this year as well made sure we've now got a recurring budget of £1.1 million for Community Solutions as well. So we can see a real increase in capacity, but also stability, more importantly, I think, in the third sector, which is going to be really vital in terms of providing that sort of lower-level supports for our local population. So I will pause there. There's a lot in that report in terms of different work streams, but I'm happy to take any questions that may arise.
There's no one in the chat. Does anyone have any questions at all? Just shout out if you do. No. Okay. Can we agree the recommendations on page 35, please? Yeah. Great. Great. That brings us on to the staff health and wellbeing update, and Morag's going to talk to that paper. Thanks.
Thank you very much, Chair. This report is brought for information and is a report that went to the Planning, Performance and Audit Committee, but we thought it would be of interest and applicability to this committee as well. Obviously, the attention to staff health and wellbeing is something which is routine within the work that we do, but in response to the health pandemic, it's been something which has had particular focus and has been increasingly done on a whole system joined up approach, so that we are being as attentive to staff employed directly by the council, directly by health, but also through our partner organisations, independent third sector organisations as well, to ensure that what's available supports the whole sector, including care home staff as well within that. So appropriate supports for staff were explored very much at the beginning of the pandemic, including like people physically recovering, spiritually recovering from the impact of the pandemic, as well as recognising the continued pressure and demands on staff, and how to make sure that the responses were more sophisticated into the future, as well as more responsive in relation to kind of reducing the risk of isolation, of the impact of fatigue, on the impact of burnout, and trying to avoid increased staff absence as a result of that. So the report at 5.3 describes some of the activities which were started in relation to NHS Lanarkshire staff, with an organisational temperature check done, and short-term measures very much introduced and thought of through that time, including the establishment of helplines, rest centres, wellbeing rooms, a whole range of e-learning, but also things which were not so directly responsive to problematic issues, but trying to encourage and maintain wellness through, like, the staff choir, and having wellness groups established to make sure that people felt involved in thinking about what would actually help and sustain them as individuals and as teams as well. The Health and Social Care Partnership Wellness Group was established in the summer of 2020, and did a lot of work in relation to coordinating resources, and really strengthening that sense of employee engagement, and thinking through the responses that were there to actually help people. That group, whilst it was introduced through gold command structures, is now fully embedded as work stream 3 in the Care Academy work. So really reinforcing that whilst this was enhanced through the period of COVID, it's not something which will now cease to exist. That the importance of ongoing supports to staff health and wellbeing are very much embedded in the work going forward. And that's reinforced by, you'll see at point 5, point 4 in the report to the PF&A committee, that trauma-informed practices and how we develop as a trauma-informed organisation are threaded through all of that, with clear identification of champions and a challenge to all of the work we do in relation to ensuring that we've got trauma-informed approaches throughout our work, including the organisational development supports and structures that exist, and a lot of the emerging plans. So the mental health and wellbeing plan for the council, supporting a kind of culture and climate of wellbeing and minimising the impact of mental health, but also promoting support and promoting employment of people with a wider range of experiences. The Working Well plans again reinforce that this is not just for a period of COVID, but something which is particularly important as we go forward, both to support attendance but also to maintain a sustainable workload. We've recently also undertaken a bit more consultation following the announcement of some additional funds from the Scottish Government, and have engaged with a wide range of staff to think through how we can use short-term resources most effectively. And the upshot of that really is that different teams need different things. So how do we make sure that we've got a structure in place which facilitates that to happen, where people that need support for perhaps more clinically identified needs in terms of psychology support get access to that, but people that want to do something which is a bit more fun-based and diversionary, like doing a yoga session at lunchtime or something like that. We've got a whole range of things that work for teams in the short term that can build into a menu into the longer term. So again, the report is quite detailed and provides lots of information, which I've kind of pulled out some of the highlights, but certainly feel like there's far more being done, but happy to take any questions from that.
Thanks very much, Morag. Again, don't see any questions in the chat. Does anyone have anything to say? Can we then agree the recommendation that we recognise and support the contents of this report? Yes? So agreed. And if Morag can draw breath, she's back on again. Number 7, engagement and participation, development to communities. Morag.
Thank you. I've had a wee drink of my juice there, so I think I can carry on. Thank you. Again, the next report is offered for sharing in a wider sense. It has already been through the PF&A committee of the IJB, and really reinforces the recognition of the importance of engagement and participation in the work that's done through the Health and Social Care Partnership and done as a whole system approach. And the reason really for the report is sort of threefold. One, in relation to the structures that have changed within the Health and Social Care Partnership, embedding the sector approaches. So we've got our 6 localities working within 2 sectors, and that, as you know, was introduced at the beginning of this year and has matured into a kind of working arrangement, which we would want to develop further. The introduction and development of the community boards and the important opportunity to link in the wider community sense, both to to kind of feed into that and to take from the wider community boards. Again, people will be familiar with the local outcome improvement plans, where very significantly mental health and wellbeing features in most of the LOIPs agreed through the community boards, and the impact of COVID-19 on our service recovery and service shape and reinforcing whole system has really meant that the kind of opportunity to think particularly about our key engagement points through partnership boards, locality planning groups, and their interface with the community boards and wider the whole system approach has caused us to take a sort of stock take on that. So we're working with VANL to undertake a review to recommend a change to the way that we engage and participate, which will be really enhancing that further, so that we're increasing the range of stakeholder involvement and voice within the way we go forward. So this is a kind of report coming to indicate that work has been done, and will be followed up into next year with the outcome and result of that work.
Thanks very much. And we have a question from Claire. Claire.
It's more a comment. Again, another really good report, and it's something that it's really good to see. Everything that we've gone through with COVID has been horrific, but there's been a lot of good things that have come out of it, a lot of learning points that have come out of it, and kind of community resilience, and a lot of the groups that have sprung out to help communities. And it's really good to see that none of the good parts of all of that are going to be lost in going forward, because hopefully to God we'll come out of this at some point in the not too distant future. But there's been a lot of the connections that have been made within the community with vulnerable groups that really can be expanded upon to work in partnership with the council and all the other organisations. So a really, really good report, and thank you very much for that.
Thanks very much, Claire. If we've got no more questions, can we recognise and support the contents of the report? Thanks, Agate. Thank you. Right, that leads us on to number 8, which is the implementation of delivering to communities. And Ross is going to speak to this one.
Thanks, convener. So this report relates back to the broader delivering for communities work and papers that have gone through Policy and Strategy Committee and already been approved. And I remember think back to the original papers they went through around this in March 2020. What it set out would be a phase 2 review to pick up adult health and social care in the broadest sense. And the rationale for that was the fact that because of the fact that this is an integrated setting, we needed to involve NHS in the programme of that as well. So as set out in section 2.4 of the report, there are sort of 8 key sections that we have undertaken as part of this review, and I'll just briefly touch on each of those as we go through. So the integration review predated delivering for communities. We signed that off back in 2018 for delivery in 2019-20 onwards. And we have now rolled out the new operational structure that we set out in the integration review. So what we've tried to do is not then duplicate and refresh that, because it was only just being implemented during the course of the pandemic. So we've now got 2 sectors, each containing 3 locality areas within our structure. So we've got Airdrie, Coatbridge and Cumbernauld in one sector, and Motherwell, Bellshill and Wishaw in the other sector. And the idea behind that is just to give us flexibility in how we can deliver services, with the aim being to have as much as we possibly can at a locality level delivery, but we can also deliver services at a sector level or a pan North Lanarkshire level, depending on the size and scale and scope of service. We've also got 4 area-wide units covering the area-wide social work services, adult mental health and addictions, children's health services, as well as an adult health services, which include services like podiatry, speech and language therapy, the prison, etc. So that structure is now fully in place and rolled out. We looked at our post-COVID-19 priorities, and this is linking in heavily into the remobilisation plans that we've submitted. and work alongside Public Health Scotland as well to really try best understand the impact on our communities and where we think the demands for services are going to come post COVID as we try our best to emerge from the pandemic. The recovery of health services just links in very tightly with that as well. And that's looking at a programme of work as well around refreshing achieving excellence. So the current healthcare strategy is now going to be programmed in for refresh. And what we are trying our best to do is make sure that that ties in really strongly for the community boards and broader community engagement structure that Morag has just been describing. So that whole system piece is just vital around this area of work. And we're trying our best to tie in the whole broader NHS services, not just the ones that are delegated to the IGB, but some of the acute engagement, etc., also through the community boards, so we can use that vehicle for all community planning partners. In terms of the IGB, we've obviously got our commissioning plan and work that we take through, including our health needs assessments, etc. And again, the whole idea here is that a huge focus of the IGB is around participation and engagement. And just as Morag's described, we see that the community boards as a key vehicle for that. So how do we build the IGB and tailor the community board piece in and around that? The strengthening the voice of the seldom heard, again, just as exactly as Morag's just been describing, the use of the community boards and our whole wider participation and engagement strategy is absolutely vital to how we pull this together. We've spoken earlier on again in the meeting around the local outcome improvement plan priorities, and we've been building on that in conjunction with the wider service, with health improvement colleagues, etc., up the middle of that programme, so that we can try our best to get a real focus on prevention as we take those forward. And finally, in terms of aligning ourselves to the delivering for community structure, in line with the broader head of service redesign, we've done a bit of work on exactly how we want to align ourselves to the community boards and broader structure. So the aim being our two operational heads of service, our head of health and head of adult social work services, will be aligned because they currently cover one sector each. They will both be aligned into the broader community board structure, and the idea being that they'll be able to coordinate a whole range of updates and inputs to the community boards. So all 9 community boards will be getting the same information at the same time and the same opportunity to influence. The head of planning, performance and quality assurance will then take on the role of making sure that broader piece that I was talking about through the NHS, etc., is also then fed into the community boards. So not just the bits that sit with IGB in terms of our community provision, but also start to pick up some of the broader strategy work in NHS Lanarkshire, and making sure that the community boards are seen as one of the key vehicles for engagement around that. And we had an NHS board development session this morning, and co-design is now coming through as a really different approach in terms of that healthcare strategy development. So it's great to see that that's really starting to feed through. Full support from the NHS board today in terms of that type of approach, and the community boards were mentioned on several occasions through the session. So we're really starting to see that moving forward. And the final element then is around, within this section, is then starting to have a look at how we can build closer links between the adult health and social care directorate, as well as education and families, and myself, my own role and the role of the Deputy Chief Executive in the new structure need to work really closely together so that we can bring that synergy between the two management teams. The last section was around independent review of social care. And largely what we're doing here is parking that. We know there's a bill expected by next summer, but until we get that out, there's not a lot extra we can do. We've obviously pulled together our responses for the council and the IGB as part of the consultation programme. But at the moment, we're just really waiting for the bill to get an idea in terms of the future direction of travel. And once we know that, then we can start to act on it. But really just looking for approval from the committee to approve the sort of second phase of the Delivering for Communities programme that was already, the sort of obviously overarching report was approved back at Policy and Strategy in March 20.
Thanks very much, Ross. I don't see anybody in the chat, so can we agree the recommendations on page 64? Thank you. Before we go on to number 9, the contracts. Ross, do you want to say your piece?
Yeah, I just want to bring members up to speed. We don't have a paper on this because we literally got guidance through yesterday. And it's not an item we need to bring to committee for approval, but we would normally bring an item, a piece through just to allow members to note the direction of travel. So just want to take the opportunity to give you a verbal feedback on this, and what we'll do is we'll bring a formal report through in terms of progress of development to the next cycle of committee. So we've got a £300 million national fund around the adult social care winter plan, and £48 million of that money is around increasing the wage for independent sector providers and social care workers. So what we have got now is there's an agreed position with COSLA in terms of the implementation of that uplift. And it's just really to make members aware that we are aiming for a start date of that for the 1st of December. We are working with the local independent sector providers to identify numbers of staff and costs, etc., so that we can try best to programme that through, so that we can get the increased pay in the December pay packets of our social care workforce within North Lanarkshire. So it's just really to make members aware that we are progressing that piece of work in line with the national agreements. But what we will do is for the next cycle of committee, we will bring a full update paper that will give you the progress made around doing that. But again, happy to take any questions should they arise.
Don't see any questions on that. Thanks very much for that verbal update, Ross. Leads us on to number 9, the procurement of mental health services. And again, it's Morag.
Thank you. The paper this afternoon is coming as the conclusion to the procurement exercise in relation to 2 lots of mental health services with a value of £3 million. So lot 1 is peer support and lot 2 is short-term intervention support. Both are important elements of service in relation to whole system response, where we have found over a large number of years now that making sure that people have got direct access to people with lived experience and the opportunity for shorter term support very much helps with the sense of either being clear about longer term support needs, or more positively helps people to manage with their mental health difficulties themselves. So the procurement process has obviously followed the council's procurement rules in relation to the way that the invites for tender have been received and evaluated. And you'll note in Appendix 1 that the detail of the organisations who have tendered and who have been successful is noted there. Appendix 2 particularly reinforcing that the evaluation has been done on an 80% quality, 20% price, which is standard for health and social care services in relation to ensuring that we've got a heavier bias on quality, but are not looking at the price element as well. So for both Lot 1 and Lot 2, SAMH have been the organisation who have been successful in the tendering process. The timescales for the introduction of service will be in February 22 and that will run to January 25. Again, happy to take any questions.
Thanks very much. Any questions on the contract? If not, can we approve the contract as at page 77? Yeah. Smashing, thanks again. Takes us on to number 10. Again, Morag. No respect here. And it's a framework for the taxes. Morag.
Okay, thank you. I'll just check that I'm not on mute. Yeah. This is similarly a report coming at the conclusion of a tendering exercise where the framework for both scheduled and ad hoc taxi use is coming today with the intention of starting the new arrangements in February next year. The tendering exercise again done in complete adherence to the rules in relation to the public contracts was divided into 4 lots this time. The first lot was scheduled service, which mostly exists around supporting people through the day, but also included 3 lots which were geographically zoned into ensuring that we had ad hoc, which really means one-off and non-regular arrangements for the north, central and south divisions, and the successful organisations, the successful taxi companies are noted against each of those 4 requirements. And again, the information in relation to the ranking and the scoring is attached for information in the appendices. Happy to take any questions.
Any questions for Morag? No. Can we then approve the recommendation on page 86? Yep. Morag gets a rest now because we're on to number 11, it's the contracts awarded by work committee approval. And Diana's going to speak to us. I hope.
Thank you, Kavina. I won't go into a huge amount of detail. It's pretty detailed in the report. This report covers the contract that's been awarded below committee approval threshold, and committee members are asked to note the content of this report. This contract is to provide direct payment support services in North Lanarkshire at a value of £411,000. The current provider chose not to apply, so Glasgow Centre for Inclusive Living were successful through a procurement process, and they have a long-standing experience of providing support to individuals, identifying personal assistance and supporting with payroll. So good experience in terms of how they'll take forward the service. We did agree to provide additional resource to this new contract around direct payments, which is seen to be key part of how we'll deliver our self-directed support strategy. Thank you.
Thanks, Diane. Has anyone have got any questions for Diane? Colin.
Yeah, thank you, convener. Sorry, I'm in a little bit of trouble today. It was just to find out, given that the previous contractor hadn't decided to carry on with the contract, apply for the new contract, we had discussions to find out why that was the case, and are we looking to mitigate that possibility with the new contractor?
Yes, it was really in terms of the tender when it went out and specification. So there was discussions with the previous contractor who felt at this time it wasn't something they wanted to continue with.
Are you okay with that, Colin? Do you want a supplementary?
Yeah, no, it's fine. I understand that the specific reasons may be unable to be discussed in an open forum like this, so I'm happy enough to know that there was discussions on the issue. Thank you.
Thanks, Colin. Can we now note the contents as per page 93? Yeah. Thank you. And back to Morag for number 12, the Adult Social Care Performance Report, Q1. Morag.
Okay, thanks, convener. I suppose one of the advantages of coming later in the agenda is that much of what I need to say has already been covered in the meeting, but the Q1 performance is provided as a routine report to highlight the areas in relation to key activities across social work services using the red, amber, green rating in relation to progress, and whilst we would normally focus on the areas of red, that often means that we don't talk about the areas that are green, but in this committee the focus on the areas that are red have largely been covered in other reports, so members will note that there is red and amber in relation relation to some of the processes around home support, particularly the number of people completing reablement and some of the performance in relation to support. And just to reinforce that there's a significant focus on supporting the home health service and ensuring that there's robustness around the arrangements in relation to particularly 7 work streams which have got wide participation, including participation of people who work directly in the service and provide support directly. So quite a kind of ambitious programme of ensuring that we've got a well-designed future in relation to the areas where we know that we would like to be doing better. In relation to the other areas that are ready equipment service, Diane has provided a separate report in relation to the current position and the focus on how we are working to make sure that we've got both improved performance and robustness of arrangements in relation to the provision of equipment and adaptations where we know that the level of demand is significant in relation to supporting people to live independently and safely within the community, and that is made more complex really because of some of the challenges around availability of raw materials for both equipment in terms of metals and some plastics, but also for adaptations where we know that there are challenges for contractors in relation to availability of materials there, although levels of demand have increased to beyond pre-pandemic levels. And in terms of staff absence, I suppose the comment particularly in relation to the focus on staff health and wellbeing really is seeking to ensure that we're doing all that we can to address the reasons that people might find that it's necessary to be absent from work and how we can sustain a high level of attendance. Happy to take any questions, convener.
Thank you. Thanks, Morag. I don't see any questions in the chat bar. Yep. Colin, you're in. Yes, Colin.
Yeah, thank you, convener. It's actually a question that had occurred to me before, but I haven't got around to asking it previously. Thank you for the report, as detailed as usual. It's a quick question regarding the staff absence numbers. Just a point of clarification. I understand the staff and management are doing the best to deal with the issues, but it's just in the sickness absence numbers. I'm aware in private business and in other public sector, they might include pre-arranged doctor's appointments in sickness absence, including things like going for your vaccinations. It's just to clarify whether those type of absences are included in this or not.
Generally, no, they are not. Councillor Cameron, the flexible working arrangements would generally, and we would be very supportive of people accessing anything that supports their own wellbeing and therefore attendance at work. So we would generally not include that as absence.
Are you okay with that, Colin?
Yeah, thank you. No, that was actually the answer I was hoping to get, because I'm very supportive of everybody going to a pre-arranged doctor's appointment to get a JAG, to get any health needs sorted. It was just to make sure, just to clarify that we aren't including that in numbers, because I have heard of other places where that happens and it doesn't sit right. So I'm glad to hear we don't do that. Thank you very much.
Cheers, Colin. Can we then note the contents of the report? So noted. And finally, the Revenue and Capital Budget Monitoring Report from Thomas. Okay, Thomas.
Thanks, convener. This is the Services Financial Monitoring Report as at 15th of October, which is accounting period 7. Starting with the revenue position and continuing on from previous financial updates to committee, the service is performing in the midst of significant COVID pressures and operational demands. As highlighted in Appendix 5, our current estimate of the in-year COVID revenue costs are £10.9 million, which includes additional partner payments, additional home support and PPE. Discussions are ongoing with the Scottish Government in terms of the totality of COVID funding the service will receive, and at this stage our working assumption is that they will adopt a similar approach to last year in underwriting the majority of our core COVID costs. And when we get confirmed updates from the Scottish Government, we will of course include this information in future reports. Across the rest of the service, there is a projected underspend of £4.3 million, which primarily reflects lower than anticipated costs linked to the home care elements of SDS, coupled with staffing vacancies and the in-year phasing of the carer support programme, which was mentioned earlier. Appendix 3 highlights the service began the year with earmarked reserves of £16.7 million to help manage the future impact of COVID demands, cost pressures and updated delivery models. Due to the service's focus on dealing with the immediate impact of COVID, the majority of this resource will not be needed in the current financial year and will be carried forward into future financial years. Turning to capital expenditure, the majority of this budget is used for aids and adaptations to allow people to live independently in their own homes. The service started the year with a budget of £2.8 million, but has taken the opportunity to realign £800,000 of this funding into future financial years due to the ongoing operational impact of COVID on their own staff, contractors and the wider supply chain. As a consequence of this realignment, in the report we are highlighting a nil variance against the revised in-year budget of £2 million. And similarly, I'm happy to take any questions.
Thanks, Thomas. Does anyone have any questions for Thomas on the report? Can we then note the report? Yeah. Thank you. Well, that's nearly the end. I would just like to say that the fact that there's been so few questions in this committee, I've never seen a committee with so few questions, is testament to the highest quality of these reports. They really are absolutely superb, and I hope we all agree with that. And that's thanks to Ross, Morag, Diane and Thomas. Just give yourselves a pat in the back, and Morag can have a long cool drink. Okay, thanks very much for coming, folks. I'll see you again. Thank you.
Thanks, Chair.
Cheers.
Thank you.
Bye.